Hello everyone and welcome back to Data Cloud Now. I'm currently in Las Vegas at HIMSS, where I'm now delighted to be joined by Jesse Cugliotta, Global Head of Healthcare and Life Sciences at Snowflake. Jesse, always a pleasure to be with you.
Thank you for having me.
Jesse, let's start with the baseline. What's your vision for interoperability and why is it so pivotal to the healthcare and life sciences industries?
Yeah, interoperability has been a topic that's been discussed at forums like this for pretty much as long as I can remember. And typically the way that it works is, somebody stands up at a conference and says, we have 15 standards for interoperability. We need to consolidate all this. We need to bring it together. Let's get together collectively and come up with a new standard. And then they'll do that. And then you have 16 standards for interoperability at the end of the day. So our way of thinking about this is not this one ring to rule them all type of approach, but rather, can we leverage the technology that already exists? Technology that's built for seamless data collaboration and sharing, like Snowflake, for example, that makes it easy to get to those same goals that interoperability was originally designed to solve for, without necessarily having to conform to a specific standard and then get everyone else on board with it. We of course still support the standards that are out there. The ability to work with data that's in an HL7 format, in a FHIR format, the ability to work with data in industry standard models like Odyssey OMOP, for example. All that still exists, but we have this saying inside of Snowflake in that when it comes to things like data sharing and collaboration, it just works. It shouldn't be a 2-year project with the systems integrator to get things on board. And I think our customers have started to recognize that. One that I always like to talk about is Corewell Health. So they are what we call a payvider. They have a payer side they're called Priority Health. They have the provider arm. And despite the fact that they all live under one collective umbrella, they don't have a consistent view of you or me as an individual, both as a patient or as a member. They don't have that level of interconnectivity internally. They said this really became a challenge when they're trying to figure out, how do we build some of these new digital initiatives that really require that complete 360 view of the individual? One of which that they actually talked about, they said, wouldn't it be great is that if you as a patient walked into any one of our 14 hospitals or 150 ambulatory care facilities, if you got a text message that said, here's your prior medical history, here's where you are with respect to your plan limits, here's what's in network, and you got all of that based on the geolocation of where you're walking into. They said, the ability to be able to share data across the internal boundaries that they have inside of their organization was critical to do that, and Snowflake is helping enable that.
Great perspective. Thank you for that, Jesse. Where is interoperability going in the future, and what impact could enhanced data sharing have on efficiency, cost saving, and ultimately patient outcomes?
Yeah, so this one's personal for me. My wife works in healthcare. She's an emergency doctor at the Jefferson Health System in Philadelphia. And I had asked her about that the other day, because we talk about this industry from a technology standpoint all the time, but it's helpful to have family members who actually work in this industry to kind of bring you back down to earth, to say, is this really how it works? Is this really the way that people are thinking about this at the end of the day? And she said, I had a patient who came in from a different health system in Philly, from Penn. They recently had surgery there, and they came in presenting of complications from that surgery. And I said, well, what does it look like when you have a patient from another health system coming in your door? How do you get information around them in terms of what their prior medical history was, what they had done? She says, it's not as glamorous as you would think. A patient has to sign a consent form. They fax that consent form over to Penn.
Really?
Penn downloads the records and then faxes them back, like it's 1992 at the end of the day. And I said, how long does that take? She's like, if it all works well, maybe an hour or two. And I was saying, how many times have you as a patient been sitting in an emergency room or in a doctor's office just waiting, and you really don't know why? Chances are it was something like this that was causing that. So, when I think about where the opportunity lies is that, there are ways to do this better. Being able to leverage data from not only inside of your organization, but outside of the four walls, to be able to enable some of these initiatives that improve efficiency, that improve patient outcomes, and ultimately end up delivering on the promise that we talk about with regard to AI.
Love that example, Jesse. Based on what you've seen this week at HIMSS, what advice would you give to the healthcare organizations still early in their data modernization journey?
Yeah, I think it starts with, what is it that you're trying to achieve at the end of the day? If I take that last example that we just talked about, what they weren't trying to achieve was, getting a pen out, signing a consent form, getting a fax done as fast as possible. They're trying to figure out, how do I triage this patient? Do I do another full workup on them? Do I admit them? Do I disposition them right away so they can be on their way? And if you kind of go back to, thinking about, how would I do this if I didn't have that procedure in place? You'd probably come up with a very different answer than, getting a fax machine involved, for example. And we saw, this kind of thinking during COVID. All of a sudden, the traditional shackles were off in terms of the way that people had to do things historically, because there were analytics requests around infection spread, around available beds, around available PPE. And those things needed to happen right now, not in 6 to 24 months when we can get the infrastructure together to support it. And so I think it's really important. We had customers like Providence and Prisma Health. They started their Snowflake journey for that exact reason. They needed to be able to do things quickly. And embracing that mindset again, I think is really critical to keeping this kind of innovation momentum going. Because there will be crises, there will be challenges again, and collectively as an industry, we need to be ready for that.
Jesse, always a pleasure. What's next for Snowflake with regards to healthcare and life sciences? And what AI use cases do you see having the most impact in the year ahead?
Well, we've heard about some exciting ones this week. I was really excited to hear about what Alberta Health Services is doing. So they actually created something that would help folks just like my wife working in the emergency department. They said probably 10 to 15% of the emergency physician's time is spent just documenting their encounters with the patient.
Wow.
It ultimately leads to some of those increased wait times that we just talked about. And then I even see here at home, sitting on the couch after a long shift, typing up notes for an hour or two at the end of the day. So what they actually did is they leveraged Snowflake Cortex to actually listen to the interaction with the patient provides their consent, and then leverages a built-in large language model to actually transcribe what that note would be. And then of course, the clinician can sign off on that at the end of the day. And as you would imagine, this is actually allowing them to see 10 to 15% more patients over the course of a year. So I think use cases like this have a real impact, not only on the patient's experience, but on the care team's experience as well. I'll give you another one. We're starting to see various different member personalization initiatives on the payer side of the house, where it makes it much easier for a patient to get prior authorization for a particular treatment, to allow AI agents to automatically call and schedule with the specialist or the provider who's involved there, and essentially speed up the process that's often very manual today, and stretches out your experience as a patient often days and weeks just to get some of the administrative workflow done. And then one more I want to talk about, and this one isn't even pertaining to our industry, but I think it'll have a big impact here as well, is I'm still coming up with a name for this, but I want to say enterprise intelligence.
I like it.
This concept of, can I leverage AI across all of both the structured and unstructured data inside of my organization to answer more complicated questions? So for example, if I'm a big health system, if I'm running a big health plan and I have a lot of employer group customers, and I want to understand, how many employer group customers churned over this past year, and what was that about their contracts that may have been different from customers who did not churn? That requires me to look into structured data around the potential impact of that churn itself, and then someone to actually pore over all of the various different contracts, or leveraging AI to do so, to actually get to that answer. I think the impact of things like this are going to be tremendous in terms of productivity for any organization that wants to adopt this. And I think as an individual working in one of those organizations, it just makes your life better. Like, you don't have to pour through all of these different documents and go to 8 different places to find the answer to your question. You can simply ask a chatbot and an AI that's enabled to do that for you.
It's very much a win-win on both sides.
Exactly.
Jesse, it's always a pleasure. Thank you so much for joining me here in Las
Thanks a lot,
Vegas.
Ryan. Take care.
And for the audience watching, I'm Ryan Green with Data Cloud Now. We'll see you soon.